Welcome, and thank you for joining us today. My name is Ellen Wilson, and I'll be the moderator for this expert briefing for the media, which is hosted by the Johns Hopkins Bloomberg School of Public Health. Today's briefing will provide an update on the current status of the COVID-19 pandemic. As Omicron continues to circulate, and with the potential for new variants to emerge, today's speakers will provide insights on what we can expect from the virus and how we can reduce transmission in 2022. They will discuss how present and future variants may impact our ability to conduct normal lives and how vaccines, treatments, therapies, testing, and contact tracing can reduce case counts and disease severity. Please note that participants are welcome to use images, video, or quotes directly from the briefing, and that the content is for immediate release. First, I'd like to briefly introduce our two speakers. Dr. Andy Pekosz is a virologist, professor, and vice chair of the Department of Molecular Microbiology and Immunology at the Bloomberg School and co-director of the Johns Hopkins Center of Excellence for Influenza Research and Surveillance. Dr. Pekosz is an expert on viruses with a focus on viruses like influenza, SARS-CoV-2, and other respiratory viruses. He has been studying SARS-CoV-2 variants to understand how they have changed to become more efficient at infecting humans and evading human responses. Dr. Crystal Watson is a senior scholar at the Johns Hopkins Center for Health Security and assistant professor in environmental health and engineering at the Bloomberg School of Public Health. Her research focuses on public health risk assessment, crisis, and risk-based decision-making. During the COVID-19 pandemic, Dr. Watson has led or co-authored a series of influential reports related to contact tracing and reopening businesses. She has produced and contributed to a series of risk assessments on topics including mass gatherings and university and business reopenings during the pandemic. We will have time for questions following our speakers' remarks. The procedure will be as follows. We'll take some questions that have been submitted in advance of the briefing and some questions from the Zoom chat. If you have a question during the briefing, you can enter it in the Zoom chat addressed to all panelists. Please enter your name, media outlet, and question. We hope to cover as many as possible. Just a note that participants will be muted during this briefing and it will be recorded. Dr. Pekosz, please go ahead.
Thanks very much, Ellen. SARS-CoV-2 variants have been evolving to become more efficient, or what we call more fit, at infecting humans in two main ways. First, they're evading immune responses generated by vaccines or previous infections, and this allows them to have a larger population of people that they can infect because previous infections or suboptimal vaccinations no longer prevent infections. We have a good understanding of how this immune evasion works based on intensive research over the last 2 years. I think the second thing that's happening with SARS-CoV-2 is that it's becoming more efficient at infecting humans, at spreading in the human population. This is something that is clearly happening, but the reasons behind this increased transmission are still not very clear and have been difficult to study. Questions like, are fewer virus particles needed to start an infection in a person? Are the viruses getting into smaller particles and staying airborne longer? Are important questions that the research community needs to answer to get a better understanding of what's driving this increased transmission of SARS-CoV-2. Immunity in the population is playing a major role in reducing disease severity. The virus can still cause some pretty serious illness, especially in unvaccinated individuals, but the immunity provided by vaccines or previous infection is really helping to keep people out of the hospital, and that's really the primary goal of a vaccination strategy. There will be more variants in the future. My apologies for being the bearer of that bad news, but it's clear we have vaccines, we have treatments and therapies, all of which can minimize severe disease in most people. We already have seen an Omicron sibling called BA2 and one called BA1.1 circulating, and we will see more. But all the work that has been done in terms of vaccines and treatments is really going to help us limit severe disease. Dr. Walkston will talk a little bit more about current vaccines, but as we look forward, there's a lot of scientific discussion about the next generation of COVID-19 vaccines and how they can be made to work against more variants and generate immunity that can prevent an infection in addition to reducing disease severity. Also, it's clear the elderly and other high-risk groups will continue to be monitored and the focus of treatment and vaccination efforts as vaccines don't work as well in some of these populations and COVID-19 disease can be more severe. We want vaccines that reduce disease severity and the number of infections so we can really avoid the disruptions in our daily lives that have resulted from lockdowns and other restrictions. And finally, it's clear that Omicron symptoms are a little different than what has been seen with other variants. This may be telling us something about how the infection has changed and may be related to increased transmission and is certainly an area of future research. Thanks.
Thank you, Dr. Pekosz. Now we will hear from Dr. Watson. Dr. Watson, please go ahead.
Thank you very much. What I'll do is just add a little on to the current status of the pandemic from Dr. Pekosz and talk about 3 other public health interventions that are still, I think, important for the next phase of our response. So first, on the current status, the US and much of the world, fortunately now, are coming off of the peak of this Omicron surge. We're seeing these rapid declines in cases, but what I want to emphasize is that healthcare and public health is still very stressed in many places, and our case numbers are still higher than we saw with any previous peak. So we still have to be careful. While these cases are ebbing, I think it's important not to jump into a post-pandemic mindset just yet. As Dr. Pekosz said, there is still a lot of opportunity for further variants to emerge, as demonstrated by the BA2 and BA1.1 variant that he mentioned. I am hopeful that these future surges will become less disruptive, though, because of the high levels and broad immunity that we've gained, really hard-won, hard-fought through vaccination and following this Omicron surge. Now to turn to a couple of public health interventions that I just want to emphasize. So first, testing is still very crucial to our response efforts. Tests are still very important to identify who has the virus, how it's spreading at the community level. It's also important for individuals to make decisions about their actions and organizations to decide what they can do in terms of mitigation measures. And finally, it helps us track new variants as they emerge. There are 2 types of tests that we're all very familiar with: rapid antigen tests and PCR tests. Now we have rapid antigen tests that we can do at home, which is a great development. But since we've passed the holidays and we're coming down from the Omicron surge, these tests should all be getting easier to come by, more available. As we all know, the White House has made some free tests available that they're sending to everyone if you request them. And we can get free testing through our insurance programs as well. PCR tests are still really important for tracking cases and confirming positive results. So it's important for us to still try to seek out PCR tests when we can. Antigen tests are so important. They're quick. They can help individuals make decisions about everyday activities, especially when they're used frequently. They become more reliable. But I just want to emphasize there too, it's important to try and either report antigen tests to your health departments. There are lots of programs to do that, and or follow up with a PCR test to confirm so we can continue to track what's happening. A second intervention that I think is still very important, but it has evolved through the pandemic response, is contact tracing. This has been a key component of our response. At the height of these really large surges, especially Omicron, it becomes less useful in terms of curbing transmission because this is a resource-intensive activity. It gets quickly overwhelmed. But it can still make a difference. It can make a difference in institutional settings like nursing homes, where we're trying to really protect the most vulnerable. It can make a difference for individuals who want to protect their loved ones by having them contact traced. And it can still make a difference in breaking transmission chains, even if it's not the only tool we're using to control transmission. In addition, as we get lower case numbers in the weeks to come, I think contact tracing is still going to be important because it can help break those chains of transmission. And as we get lower transmission, it drives it down more. And it's this really kind of reinforcing cycle. So I think that's still a key intervention. And finally, I wanted to mention that Dr. Pekosz mentioned that I would say something about current vaccines. We have some good news that Pfizer has applied to make vaccine available, hopefully for children aged 6 months to 5 years old soon, or 4 years old soon. It is important, I think, if this happens and it gains emergency use authorization from FDA and a CDC recommendation, that we really do move forward to get these young kids vaccinated. Having this more fully vaccinated population can really help us all reduce further transmission, illness, and death, and will help us limit disruption in the future, including school and work for adults. With that, I think I'll conclude and happy to answer your questions.
Thank you, Dr. Watson. Now we will take questions. If you have a question, a reminder to please enter it in the Zoom chat with your name, media outlet, question, and to whom you'd like to address your question. Here's the first question from Margaret Nicholas for Dr. Pekosz. What more do we understand about who will suffer from long COVID, whether this varies according to the variants that infected a person and the long-term outlook or treatment for long COVID?
Great question. We know that long COVID, or its official name is now PASC, can occur from a variety of different types of disease severity. We haven't been far enough into this Omicron surge to be able to say anything specific about Omicron and its ability to induce long-term COVID or PASC, but it's something that's really under heavy scrutiny right now. We're trying to monitor the fact of whether or not this somewhat less severe Omicron infection might turn into fewer cases of long COVID. I think the other thing that's important to note is vaccination followed by infection has been shown to lead to a much lower rate of long COVID, and certainly a lot of the Omicron cases are occurring in vaccinated individuals. So it's something that needs to be monitored for Omicron, but I would expect that with the increased use of vaccination that we'll have a lower incidence of long COVID with the current Omicron surge.
Thank you. Here is a question from Stephanie Ramirez with Fox 5 DC for Dr. Watson. For indoor and school mask mandates, when can members of the public and students safely remove their masks indoors?
That's a great question. I think right now is not the time to do that. We have such high levels of virus circulating in our communities. For many communities, we are at or above 100 cases per 100,000 per day. And what we want to get down to is more in the range below 10. Below 1 is really where we want to be. And so I think CDC has some good guidance about the levels of transmission and recommendations for masking for people who are vaccinated in particular. And so I think one component of this decision will be when can the youngest kids and all kids really have the opportunity to be vaccinated. Once that occurs and we have much lower levels of transmission, then I think we can have these conversations about masking in schools, but that may be a little while to come yet.
Great, thank you. And also for you, Dr. Watson, a couple of questions from Valerie DeBenedette from Very Well Health. Some states are reported to be scaling back on contact tracing. Why are they doing that, and is this wise?
Yeah, so there are lots of different situations across the health departments around the country with contact tracing. Like I said in my opening remarks, when we have such high levels of transmission, it's really, really difficult to keep up with all of the cases and contacts with contact tracing. It's so resource intensive. So in many places, I know health departments are having to really triage their activities, and particularly contact tracing, focus on those institutions where people may be the most vulnerable for infection or severe illness and death. So including long-term care facilities, schools are a good example for infection risk. So I understand that need to really focus resources in that way. And I think as we get further along in the pandemic, we have lower transmission, then scaling back on contact tracing will be a little bit easier. We do want to keep in mind that there will probably be future surges of the virus, and we don't know what those new variants will look like. So important not to eliminate this capacity right now.
And also from Valerie to Benedette, have there been issues with people not wanting to respond to contact tracing?
Yes, I think there will always be some people who are hesitant to engage with contact tracers. I know that happens in all sorts of settings with different outbreaks. I think the evidence shows that the vast majority of society has been willing to engage, and there have been some really good progress and interventions from public health working on making improving scripts and making better, more approachable contacts and building trust with communities so that people are more willing to engage with contact tracing.
Great, thank you. Here's a question from Karen Weintraub at USA Today for Dr. Pekosz. Is there any data showing reinfection with BA2 after a BA1 infection? Is there any protection from an infection?
So there's not much data on whether people infected with the original Omicron BA1 can be infected with BA2. There's some reports out of South Africa suggesting there's increases in cases of BA2 in areas that previously had a large surge of BA1, but whether those are reinfections or not is still not clear. When you look at BA2 on paper, it should be close enough to Omicron so that if you were infected with the original Omicron, you should be protected against BA2. But right now, there's really no data saying that the BA2 surge is really driven by reinfections of BA1 infected individuals. Right now, it looks like most of the BA2 infections are in new individuals, people who haven't been infected with Omicron.
Great, and one quick follow-up. How dangerous are the new Omicron variants, BA2 and BA1?
So both of them pose some risk, similar to the original Omicron. BA 1.1 has one particular mutation that makes one of the monoclonal antibodies currently being considered for treatment less effective. BA2 has a few other mutations that are different from BA1. The early data suggests that there's no more increased disease severity with either one of those variants. There may be a little bit of a transmission advantage with BA2, but these are very early studies right now. Scientists have their eye on both of these variants and are continuing to look for them and to characterize their cases so we can get a firmer idea quickly of just how dangerous BA 1.1 and BA2 are to the human population.
Great, thank you. And for you, Dr. Watson, a question from Austin Landis at Spectrum News. You said we're not at the point where we can shift to a post-pandemic mindset. What benchmarks are you looking for that would indicate we can shift to that mindset?
Yes, that's a really good question and something we need to continue to work on to set some of these goals in terms of metrics for more of a post-pandemic period. What I'm looking for is kind of sustained reduced transmission. Also, if we do have new variants and new surges of cases, that what we see is that protection that we've both talked about from vaccination, from prior immunity generally through vaccination and prior infection, that we don't see these large surges in hospitalizations and deaths that we've even seen with Omicron. I think once we see that, we may still see surges either seasonally or perhaps multiple times a year from this virus. But once we start to see that even more disconnected from hospitalizations and deaths, that's when we can kind of start to take a deep breath and really think about how we treat this virus going forward.
Great, thank you. And also for you, Dr. Watson, from Jamie Martinez from Spotlight, PA. How risky of an environment are schools?
Yes, so when we say risky, I think about it with two components. So the likelihood of someone being infected in that environment and the consequences of that infection. And so I think with schools, it depends on the mitigation measures that are in place. A school with very few mitigation measures, without masking or improved ventilation, and with very few people vaccinated, that can be very risky in terms of transmission. We have evidence from CDC that schools that are not taking those precautions, these variants, the virus is going to spread pretty readily. Kids are in very close contact with each other, and they transmit about as efficiently as adults. So, but when we see those mitigation measures in place, we've seen pretty good reduction in that transmission risk. We also know that children and adolescents are less at risk for severe illness and death, although that doesn't mean no risk. There are still many kids, unfortunately, who've gotten very sick and died from this. But that is a lower risk for them. Adults in the school are at similar risk, and hopefully they're vaccinated, and that can mitigate some of that.
Great, thank you. Here's a question for Dr. Pekosz from Jessica Rendell with CNET. How has Omicron changed what health officials understand about COVID reinfection? Before Omicron, many experts were saying getting COVID twice was an uncommon experience.
Yeah, Omicron represents a form of SARS-CoV-2 that has drastically changed the parts of its protein that antibodies that protect us from infection normally recognize. So it almost represents the far extreme of a SARS-CoV-2 variant in terms of being able to evade that pre-existing immunity. Now, it doesn't evade all pre-existing immunity. And that's why we're seeing in people who have been particularly previously vaccinated and boosted, we're seeing a very, very strong protection rate against hospitalization. And we're even starting to see a strong rate of protection against infection. But it represents the kind of variant that is it's changed its surface coat in a way that makes it harder for our immune system to recognize. Again, that turns into a milder infection because of that pre-existing immunity that still recognizes it. And at the end of the day, if there's a silver lining here, people who have been vaccinated, boosted, and then infected look to have an incredibly strong immune response. And that immune response is broad enough so that it recognizes many of the other variants that have emerged already. So we're really in a situation where vaccination has laid the groundwork for strong immune responses. And now, even if you do get infected, the end result is a milder disease and a stronger immune response to protect you from the next variant. So this is the strategy that is going to work to control SARS-CoV-2 and make it less of what we call a pandemic and more of an endemic disease.
Great, thank you. Super helpful. Here's a question for both of you, if both of you would like to comment, from Adriana Rodriguez at USA Today. COVID deaths in the US are higher during the Omicron variant than any other wave of the pandemic, but death rates are lower. How do US death rates compare to other countries around the world? Are we still outpacing other comparable countries? If so, why do you think this is happening?
Well, I can chime in first, perhaps. The critical thing about the U.S. is the large portion of unvaccinated individuals, and it's clear that Omicron is still a pretty severe disease in that population, and that's driving up total numbers of deaths. Overall, there are fewer deaths per infection that are occurring even in the U.S., but the numbers aren't as good as we've seen in other parts of the country, in other parts of the world, I should say, probably because of the low vaccination rate here in the U.S.
Dr. Watson?
Yeah, I agree with everything you just said. I did see, and I've seen a few analyses just kind of comparing the U.S. Cases, hospitalizations, and deaths to that of other countries who are more highly vaccinated, like Denmark. And we really could have avoided a lot of hospitalizations and a lot of deaths with a higher vaccination rate. So yes, I think unfortunately other countries are outpacing us there.
Okay, thank you. Next one, here's a question from Kate Amara at WBAL TV for Dr. Watson. In our state of Maryland, this is the last day of a temporary state of emergency. However, the governor announced many public health measures it allowed for will continue, including mass testing centers. Is this the kind of key intervention that will help moving forward?
Yes, I agree with extending those mitigation measures. I think having access to testing is really critical. I think while we're in this very high transmission zone, it's important to have those tests available and also to have interventions like masking mandates or recommendations in place, because we still need to bring transmission down quite a bit until things are more comfortable in our communities. So I agree with that action.
Great. And Dr. Pekosz, anything to add to that?
No, I agree completely. It's great that we've reached our peak and are on the way down, but we need to get much, much lower in terms of the case numbers before we can really seriously think about sort of scaling back some of these interventions and testing procedures, because we just don't know where the bottom is going to be right now. And we need to keep monitoring and making sure we're driving these case numbers down as low as possible, as quickly as possible.
Dr. Pekosz, what do you predict the next variant will look like?
Oh, I've learned by now never to predict where these variants are going to go. But I do think that some general principles will apply. You'll probably see a variant that looks different than Omicron in those areas where antibodies bind to the spike protein, because it's clear that evading those antibody responses, particularly those responses we call neutralizing antibody responses, antibodies that neutralize viruses' infectivity. It's clear that this virus is evolving to try to move away from those neutralizing antibody responses. So we'll see some mutations in the spike protein that evade some of those responses. But at the end of the day, the virus is inducing some pretty strong immunity in the population, and it eventually will put itself in a pigeonhole where it won't have much ability to change to drastically get around the immune responses. And that will be the time when we can really start talking about this as something more like seasonal flu, as opposed to the pandemic virus that it is still to this day.
Another question related to Omicron for you, Dr. Pekosz, from Margaret Nicholas. Can you talk about why antigen rapid tests seem to be less effective in identifying Omicron?
Well, I don't know if they're less effective. There certainly are probably better ways that we can devise to use rapid antigen tests specifically against Omicron. Omicron has changed some of the symptoms that we were normally associated with SARS-CoV-2 infection. And that may say that the virus is present at higher concentrations in different parts of your respiratory tract. So rapid antigen tests will still work. As Dr. Watson mentioned previously, the critical thing about rapid antigen tests is you should be able to have a few of them and use them frequently to be able to really get at the question of whether you are infected or not. So Omicron is challenging the way we're testing simply because it looks like it's a slightly different disease, but rapid antigen tests are still working, especially if you use multiple tests over an extended period of time to really address whether you're infected or not.
Great, thank you. The last question for Dr. Watson. How close are we to vaccines, treatments, and tests for specific variants?
Dr. Pekosz can probably weigh in here too. So I do know that some of the manufacturers are working on Omicron-specific vaccines, and we may see those in the next couple of months. Treatments as well, targeting Omicron, I'm sure are in the works. And tests, as Dr. Pekosz just said, our tests are actually working pretty well with against all types of variants. We sometimes may need to pivot slightly, but they are working well. What I'm really looking forward to is these broader vaccines and maybe even treatments against multiple variants and possibly multiple coronaviruses. This is a really hard thing to do, and I know I'm not a vaccine researcher, but that would be something that I would hope, and I know we're putting a lot of effort into to try and find something that can be a little bit more durable beyond variants. But Dr. Pekosz, please jump in.
Now, yeah, I think one of the main questions right now is that we're undergoing vaccine programs now in a very different environment than we were a year and 2 months ago when the vaccines were first rolling out. When the vaccines first rolled out, most of us had no antibodies to SARS-CoV-2, and we were vaccinating what we call a naive population. Now, there's a lot of people with vaccination histories, with infection histories, and we're now trying to find ways to fine-tune those responses with new vaccines. That's a very, very different question. And it's also a much more complicated question because of all the variables that are here. Did you get vaccine first? Did you get infection second? Were they reversed? Were you partially vaccinated before you got infected? All of these things are variables to consider in our strategies going forward with vaccines. And there are a number of clinical trials that are going on right now to get firm answers to all of these questions.
Perfect. Thank you both for your presentations and insightful answers. We will email the links to the resources mentioned today and shared in the chat. And with that, I'd like to say thank you again to everyone for joining us today.